Minister Larson, ambassadors, colleagues, honored guests, and colleagues. Good morning. I'm pleased to be here at this inaugural Food Summit, Better Food for More People, representing the government of the United States. Thank you for welcoming me and for welcoming our colleagues here to this wonderful city and country. I specifically represent the Food, Nutrition, and Consumer Services of the U.S. Department of Agriculture, and I oversee the major government feeding and nutrition programs in the United States. Our mission is to harness the nation's agricultural abundance, to end hunger, and to improve health in the United States. We strive for all Americans to have access to and to consume healthy, affordable foods, and we work to overcome geographic and socioeconomic barriers to that goal. Our agency administers 15 domestic nutrition assistance programs, touching the lives of approximately 1 in 4 Americans each year. We're also responsible with the U.S. Department of Health and Human Services for issuing comprehensive, evidence-based dietary guidelines for Americans every 5 years, and the guidelines accompanying the MyPlate consumer icon, and ensuring that these tools are woven into the fabric of national nutrition policy and education initiatives. I like to step back or step aside to paint a picture of public health nutrition in the U.S. with a special focus on two of our greatest simultaneous challenges: food insecurity and diet-related disease and obesity. We define food insecurity as lacking access to enough food for an active, healthy lifestyle. The Census Bureau estimates a current U.S. population of 324 million people, making the U.S. the third most populous country in the world after China and India. USDA research has estimated that the American population comprises approximately 124 million households nationwide. Food insecurity is present in approximately 14% of all households and in nearly 21% of households with children. It's present in every state, in every county within every state in our nation. Sadly, food waste is a concurrent issue. An estimated 90 billion pounds of edible food goes uneaten in a year, or about 31% of the food supply at the retailer and the consumer levels. Diet-related disease and obesity rates are also striking. Recent data from the Centers for Disease Control and Prevention estimates that 70% of adults in the U.S. are now overweight, including the nearly 38% who are classified as obese. Half of all American adults now have one or more preventable diet-related chronic diseases, leading to increased healthcare costs and a weaker nation. Further, approximately 32% of children and teens aged 2 to 19 are overweight, including approximately 17% who are obese. These young people are at greater risk for diet-related disease even that early in their lives. As the health statistics attest, Americans are consuming far too many calories and too few fruits and vegetables. Of the calories consumed, about 13% are from added sugars, and about 11% are from saturated fat. As a population, Americans also consume about 50% more sodium than recommended. So how are we addressing these issues? First, we at the U.S. Department of Agriculture are continually refining our 15 nutrition assistance program to meet those challenges. Our major nutrition assistance program have been in place for about 50 years, providing an important safety net for all Americans. These programs are instrumental in eradicating the severe hunger and protein calorie malnutrition that was present through the early part of the 20th century, right up to the middle part of the 20th century. Today, our focus has shifted from protein calorie malnutrition to food insecurity and diet-related disease and obesity, two tragic, complex, and frequently simultaneous problems. Often those with the most limited resources are also those with the most limited access to fresh, healthy foods such as fruits and vegetables. Our programs are designed to work through all levels of government, as well as to harness the power of community and private sector stakeholders through ongoing partnerships in service delivery, incentives, education, and training. Today, our nutrition assistance programs are designed to proactively confront the challenges of food insecurity and obesity and to build a strong evidence base beginning in the gestational period with a special supplemental nutrition program for women, infants, and children, commonly known as WIC. I'm a federal employee in the U.S., and we are addicted to acronyms. So WIC is a way of describing the Women, Infants, and Children's program. Through the WIC program, new and expectant mothers, infants, and children up to age 5 receive benefits for prescribed monthly food packages that are rich in the key nutrients for these particularly vulnerable populations. As indicated in the program name, these foods are meant to supplement the regular diet to ensure nutrient needs are being met during this critical period. Currently, the WIC program serves nearly 8 million participants each month. Approximately half of all the infants born in the U.S., about 2 million, each year participate in the first year of life. For school-age children, we offer the National School Lunch Program and the School Breakfast Program. School lunch now serves over 30 million students each day, and over 14 million students have breakfast at school, respectively. And I might say, as a sideline here, a Scandinavian company, Huhtamaki, a Finnish company, is a great partner with us in providing compostable food trays for these millions of children that go through the school line, rather than we don't have the personnel, the manpower in these schools to wash those dishes for 30+ million children. So trays are used, and again, the Huhtamaki trays now are available in the largest school systems across the country. We love that because they're compostable. Student meals are subsidized at various levels depending on family income status. Over 2/3 of participating students receive meals at a reduced cost or at no out-of-pocket cost to the student. School meals must meet recently updated nutrition standards, focusing on all the major food groups, key nutrients, and age-appropriate calorie ranges. Our largest nutrition assistance program, the Supplemental Nutrition Assistance Program, commonly referred to as SNAP, provides monthly food purchasing power via electronic benefit cards, like a Visa card. The benefits may only be used to purchase food. They may not be used for any non-food items and are not transferable to cash. Currently, over 43 million people participate in SNAP each month, and the number is actually down from a high water mark of in excess of 47 million in 2013, reflecting what was going on in the American economy. As the economy begins to recover from the Great Recession of the 2000s, we're seeing the decline in the actual participation rate. The SNAP Nutrition Education and Obesity Prevention Grant Program, commonly known as SNAP Education, provides about $400 million nationally for interventions that include direct education, social marketing, policy systems, and environmental change to promote healthy diet and more physical activity choices. Through each program, we work to increase access not just to food, but to nutrient-dense food, to fresh food, to locally grown food. And for example, in the year 2008, the numbers of farmers markets across the U.S. and direct marketing farmers that accepted these electronic benefits was under 1,000. This year, we're up over 7,000 plus farmers markets in the U.S. that provide access to those SNAP benefits at the farm table or farmers markets. And farm-to-school programs, as they're known, are operating in 42% of the nearly 100,000 public schools across the U.S. Farm-to-school is a way of both promoting local agriculture, but also educating students to where food literally comes from. Evidence-based nutrition is paramount within our programs, and we're employing new techniques to promote healthy choices. Schools are encouraged to use principles of behavioral economics in the lunchroom. Research shows that simple changes can have a big impact. For example, for elementary age students, in the U.S., we promote something called offer versus serve, where the child comes through the food line and picks choices, makes a choice. And one of my favorite examples in this regard, using behavioral economics, is I've seen in schools labeling the carrots as X-ray vision carrots. Now, what elementary child can resist trying X-ray vision carrots as a way of, again, incenting or encouraging the child? And since that simple change recommended by university research has been made in many schools, the consumption of carrots has increased 100%. Another federal department, the Food and Drug Administration, also has revamped the nutrition facts panel that's required on all packaged food products in the U.S. And again, it's encouraging to see both through our education program, consumers are being encouraged to look at the facts label when they purchase something. Look at the fact, and it is, the requirements for that facts label are set federally so that the major components in these food packages are listed in the order of their presence in the food product. This includes information on added sugars, as well as more clear delineation between serving size and package size, and the calorie limits for each. The basis for nutrition aspect of all federal nutrition initiatives, whether in the form of standards, goals, or education, is something called the Dietary Guidelines for Americans. We rely on research, for example, through the Cochrane Collaboratives, to look at what's the basis of science and research on these various food products. These guidelines, based on a rigorous review of current scientific evidence by a panel of independent experts, define the parameters of a healthful diet for children and adults over the age of 2. And the Department of Health and Human Services also publishes evidence-based physical activity guidelines for Americans. These recommendations go hand in hand with the dietary guidelines to promote overall healthy lifestyles. And now more than ever, we're working to incorporate these guidelines into the daily lives of all Americans. Our popular consumer icon representing the tenets of the dietary guidelines is known as MyPlate. This replaced for many, many years in the U.S. there was something called the food pyramid, and with much research and a fair amount of dollar investment, we created the MyPlate. You will see this icon really commonly across the U.S. On food packaging, but in schools, in hospitals, in college eating centers, and obviously in medical schools and nutrition education programs. A quick glance at MyPlate serves as a reminder, for example, make half one's plate fruits and vegetables. We're striving to make MyPlate ubiquitous in educational settings as well as in consumer food settings such as supermarkets. And our consumer resources are designed to help our audiences find realistic solutions when it comes to their top food decision influencers: taste, cost, and convenience. We've redefined our nutrition education methods and have increased our social media presence. We've leveraged technology to develop interactive tools for consumers and are providing hands-on technical assistance to our program providers. We're employing principles of behavioral economics and connecting local producers with consumers. Our hope is to use every scientific, communications, and policy tools available to make the healthy choice the easy choice for all Americans. Thank you again. I look forward to further discussion on this theme throughout the day.